Thank you. Thank you. Thank you. And good morning. Is there a compliance officer in the house? Wow. It's so nice to be here with you at our Orlando, Florida meeting. There is just something magical about being in Orlando. Believe me, I was shocked. I was surprised when I showed up last night, just before dark, in a cab to check into the hotel. And there, in front of the hotel, is this humongous pyramid. And the first thought I had was, wow, I hope the hotel didn't go to too much trouble to work with my slide presentation. But it's an incredible coincidence, and it's a reminder of how much we human beings like pyramids. And the interesting thing about pyramids is they represent, I think, stability. It's difficult to topple over, you know, they don't come and go. They tend to be very permanent. And that is, I think, a very important message to convey this morning, the permanence of compliance. And so what I want to do this morning is actually go into our compliance pyramid and think about the 5 major building blocks that make for the compliance pyramid. Let's go in to the bottom left part of the pyramid. We're now talking the foundation of what we do. 2 parts to that foundation. The part on the left is establishing an effective compliance program. Let's go into that. Setting a tone that may look like I just wanted to have something at the top, but setting a tone is so terribly important. If there's one takeaway this morning, it's that what you do is extremely important. But it's not about us, it's about our function. It's about the purpose of what we do. So we need to incorporate that in everything that we do. We don't need to take ourselves seriously, but we certainly need to take the function seriously. So we set a tone by understanding that we really are very important to the enterprise. Strangely enough, there are plenty of organizations still that don't understand the importance of compliance. If it's important, it's not important just to us, it's most important that it be shared, and that it be shared in ways that are understandable to everybody. So we need to focus on our plain English in providing useful and relevant and applicable codes and policies. They're written out. People can read them and understand them. Training and outreach. It doesn't matter if we have them in the books if people aren't given an opportunity to read and then to engage with them, to understand how they work in practice. So we devote a lot of attention, don't we, to training people and to providing the outreach so that every corner of the organization is aware of what we're doing. We're there to address problems. We're not a problem for our enterprise. We're there to address the problems that the enterprise faces. And it faces them every day. These are institutions that are operated by us imperfect human beings. We're there to help them address problems. And we keep things clean and operational by engaging in internal auditing and monitoring. Utilize available resources. If one half of our foundation is establishing an effective compliance program, the other half is making sure that we're taking advantage of all of the tools necessary. Compliance program guidelines. Most of you, perhaps with the exception of some newbies, are familiar with the fact that OIG has been promulgating compliance program guidance since 1999. And those guidances are on our website. They cover nearly every corner of the healthcare industry. Everything from nursing homes to hospitals to physicians, you name it. There's a compliance program guidance that you can find easily available on our website. Also on the website, advisory opinions, fraud alerts, open letters. We note especially in this part of the pyramid, May 18th, because we're going to be doing a national webcast that will allow everybody. You don't have to be in Baton Rouge. You don't have to be in any particular city that we're holding these series. You'll be able to take advantage of what we're doing just by going on the web. And of course, it's very important to keep up with all of the resource guides. A recent publication, which again is available on our website, that is what we call a physician's guide to avoiding Medicare and Medicaid fraud and abuse. Let's move up to the middle area of the pyramid. And this is where we're looking at the things that are coming around the bend now, the new stuff. We have our foundation of a compliance program that we know is permanently based, and is critical to the organization. We know how to take advantage of the resources that are available, both within our office and externally. Let's look at some of the new challenges that we all face in our field. We're definitely on a government page. Yeah, we see the eagle, the eagle side of the seal of the United States, so there must be some government stuff here. So let's look at these points. The Affordable Care Act. The Affordable Care Act has a lot of new requirements coming down the road. We all need to be familiar with it. Let's capture the idea in the three key words: transparency, compliance, and accountability. I note the shift from pay and chase. As many of you know, especially the veterans, for many, many years, we've had a system that was too relaxed. And the mandatory compliance, well, as I said earlier, it's one of the key reasons why we're engaged in such aggressive outreach on compliance training, is that looking down the road, not just the larger players in our field, but nearly everyone has to be thinking about how to structure an effective compliance program. We'll move over to the left side of the middle of our pyramid, and that's understanding the consequences of non-compliance. We're working on getting the right stuff done in the right way, and we also have a good understanding of the consequences of non-compliance. Handcuffs. That's a little bit overly dramatic for this audience. I think we were trying to come up with a visual that would gain attention, be relevant to at least some of the points. That is not a point of intimidation. But we did want to give me a chance to note how actually pleased we are with the successes of our Medicare fraud strike force work. Because over the last several years, we have really, through better data collection and real-time data use, we've really been able to make substantial inroads. We have brought to the Treasury billions of dollars over the last several years, not just millions, but billions of dollars. On False Claims Act liability and director and officer accountability, we note that because, again, the stakes, if anything, are getting higher when it comes to ensuring that compliance is done appropriately. You know, with a requirement now that overpayments be accorded within 60 days of their having been found, it's more important than ever to understand that a failure to be active on the compliance front has significant False Claims Act exposure. So we need to be on top of that. On self-disclosure protocols and corporate integrity agreements, there's a certain yin and yang there, because I do think it's better to self-report, to have an effective compliance program that finds the overpayment, that finds the improper claim, you know, that can find these issues before government needs to detect them. And at the top of our pyramid, our purpose is to maintain an ethical and healthy organization. That's what is really the umbrella for what I've been talking about this morning is that you're thinking comprehensively. And when I say you're thinking comprehensively, these are the four elements that we think of when we go into the top of our pyramid. We're thinking of training not as a one-time exercise, but as something that's ongoing. And I was really struck when Roy said that there were 52 conferences. That's essentially a conference a week that HCCA has held over the last year. That's a good example, I think, of organizations thinking about the importance, not of just doing a training session and then checking that box, but thinking of training as something that needs to go on all the time. It's very, very dynamic. Best practices really is tied to the ongoing training because it really gives you the opportunity to think about how to develop your compliance program in a way that is optimum. And you do that really by attending the training and by putting on the training and then by making sure that everybody is communicating with everybody. And when I say internal communications, what I'm talking about is using communications horizontally, vertically, diagonally, using the new social media that is now available, whether it's Twitter or Facebook or stuff that is certainly beyond my capacity to understand, but everything can go viral in a very good way when it comes to compliance. So take advantage of internal communications. And the last point, acknowledging compliance excellence. You know, that again is not a throwaway point. I have no doubt that there are very, very effective, capable people, certainly in this room, but in your organizations back home as well, who should be recognized for their excellence in this compliance professional field. And I am not in a position to recognize them. I'm just the Inspector General. But you can do it. And that brings us to the very tip top of our pyramid. And lo and behold, we have another pyramid. Where have you seen that pyramid? Oh, you know that it's on the... So when you go back to the office and they say, what did the IG talk about? You can say, he showed us the money. Well, he showed us part of the money. He showed us part of the money. It's on the left side of the greenback part of the dollar bill. You know, earlier we saw the eagle of the seal. And this is something that Franklin Roosevelt, who actually put this on the dollar bill, really appreciated. The seal of the United States is like a coin, really. And so the eagle is where the president's profile would be. If you turn the seal over, it's the pyramid. What's the pyramid doing there? Well, it's, you know, it's an ancient symbol. I see, you know, there's Latin there. That Latin actually dates back to Virgil in the Aeneid. The bottom of the seal is loosely interpreted as a new order for the ages. And it was meant when it was designed in the 18th century by the founders to say, young American Republic, getting on without kings and queens. It's a new order for the ages. And I think it has some relevance to us because with the Affordable Care Act and now quality involved with payment, we have something of a new order for the ages. And if we look up at the top, we see, well, we see an eye. And, you know, 3,000 years ago, an ancient Egyptian seeing that eye would have assumed you were talking the eye of Horus, H-O-R-U-S, which was a divine presence for Egypt. But that symbolism was reinterpreted in the 18th century. There are certainly a lot of Freemason involvement with it as well, but it was reinterpreted in the 18th century as the eye of providence. And what I would like to do this morning with you is to reinterpret it for the 21st century as the eye of compliance. And who is the eye of compliance? You are the eye of compliance. You are the eye of compliance. Here. You have that eye. You are aware of what it's taken to get us to this point, and you have a great sense of where we're going to need to be as healthcare reform unfolds and the field gets complicated, but as important as ever as far as what we do. So you are the eye of compliance. And that Latin expression on the top, in the 18th century it was meant to say, the Almighty has favored our undertaking. And I would, in a sense, reinterpret that for our 21st century to say that in whatever capacity, whatever power I have as the IG, you should know that this morning we favor your undertaking as effective and empowered compliance officials. And with that, thank you again for inviting me. I always love to be here, and best wishes for continued success. Thank you.